Hello, I'm Dr. Craig Butler, your Northwest Ohio chiropractor, and today we got Kim here, and we see Kim. We were seeing her a little more regularly there, but it's been a few weeks now.
Right.
So yeah, you doing a little better?
Yeah.
Yeah, and her she gets left-sided lower back pain. And today it's really not horrible. It's a little higher. It's right there.
Yep.
L5.
Yes.
So sometimes it's her left sacroiliac joint. Sometimes it's an L5. Today it feels like L5 is really a little angry at her. Good. She's a fellow guitar player. We like to chat about that.
Absolutely.
Yeah, a little jammed up in there today too. Okay, well let's take care of that.
Okay.
Yeah. Have you on your side facing this way? Right there. Good. Our class is going.
Good. Yeah, very good.
A little bit.
That felt it.
I'm gonna get on that side joint too.
Okay.
Good. To the other side.
Okay.
So, Kim's working on a master's degree right now because she's a glutton for punishment.
Yes, I am.
No. Well, you're gonna do some teaching probably, and
That's the plan, probably. Yep.
she's a nurse. Nurses tend to like chiropractors. They
Yes,
work
we do.
pretty high stress jobs.
Right.
They're always helping move patients around, screwing something up.
Yep.
One more. Good. Alright. Let's have you lay on your back.
Okay.
Cross your arms. Any shows coming up?
No, not till May.
May? Oh, okay. There we go.
Oh, man, that's
Have a
better.
good one.
That's better. Much better. Okay, you remove these.
I think they're okay.
And take them off.
Okay. Alright. We're going to adjust your neck in the chair.
Yes.
Yeah, it's a little lower there. Okay. Come on up. Alright. We're going to come down here. This is T1. Right there. Not too bad up top there. So, see if we can get that to move a little.
Okay.
Right there. And come back a little. Good. That was it.
Yep.
We're going to get on that same joint on the other side. And this time we're going to rotate a little more. Good.
Yeah.
Nice and easy.
That felt good.
Let's have you lay face down.
Okay.
Oh, that loosened up nice.
Yes, I can feel it.
Yeah, I didn't think it released that much, but it did. So, great. Oh, you're doing much better. Okay, let's bring you back in the chair. Beautiful.
Oh man, that's a lot better.
Isn't that good? Moved really good today.
Yeah,
So,
absolutely.
hey, why don't you tell them what you think about getting adjusted here?
It's been my experience with Dr. Butler. He listens to your symptoms, he listens to what you had to say, and I've had great results. When I initially started coming in, like you said, I had, my back was really kind of screwed up down at the bottom, and towards my lower back. I'd have a lot of hip pain, couldn't get comfortable standing, sitting, lying for any length of time, and a few adjustments down the road, and he's done great work for me, so I highly recommend it.
Great. Well, thanks, Kim. You guys have a great day. I'm Dr. Butler.